Hey, David, you are live on Truth Wanted. What's going on?
Hey, Dan. Hey, Sarah. How are you guys?
Yay, it works. Hey, David, we're doing just fine, I guess. Just hold up here in my place. So how are you doing?
I'm pretty good. I'm still alive, so that's good, right?
Cool. Yeah, for sure. So you have an interesting thing I think you want to talk about, the HCID classification when it comes to COVID-19. So tell me about that.
Yeah. Are you familiar at all with that or no?
To be honest, I'm not 100%. If you ask me what that acronym is, I couldn't tell you. So you'd have to probably tell
sure.
me.
Yeah, all right. Well, I mean, I just Googled it. I found out myself. It's not like I'm an expert in this stuff by any means. But the UK government has a classification system, I guess, and it's an acronym. And it stands for High Consequence Infectious Diseases, HCID.
Okay.
So probably like a month or so ago, early on, maybe a little more than that, they had classified, the UK government had classified COVID-19 or coronavirus as a highly consequential infectious disease. So comes to March 19th, and they updated the status. They changed the status of COVID-19 from HCID to, and this is exactly what it reads. It says, as of March 19, 2020, COVID-19 is no longer considered to be a high-consequence infectious disease. And I was just wondering, there's a few other things I could bring up also that are interesting, but, as far as what the definition of a HCID is, basically they say it would include acute infectious disease, typically has a high case fatality rate, may not have effective prophylaxis or treatment, often difficult to recognize and detect rapidly, ability to spread in the community and within healthcare settings, and requires an enhanced individual, population, and system response to ensure it is managed effectively, efficiently, and safely. So they no longer think any of those things apply to COVID-19. And this is coming from the UK government.
Now, did they put out a statement as to why that they decided to do away with that classification?
I honestly, I have probably not done more than just, look into, what they actually stated. I had other information prior to this that, just from my understanding of how the world works, and I'm highly skeptical of governments and mainstream media news, as I know is probably the opposite, I think, of probably how you view things. I hate to say it. But, for me, right from the beginning, I auto-hoaxed this thing. And, now it's coming to light that, there's another information. Are you familiar with Neil Ferguson?
Neil Ferguson? Yeah, I'm familiar.
Yeah, Neil Ferguson, yeah. Yeah, are you familiar that he revised his own projections recently?
No, I'm not familiar with that, but that wouldn't surprise me.
He had a massive revision. He had initially, I think it was somewhere along the lines of 1 to 2 million potential deaths from the COVID-19, from coronavirus. His new revision is up to 20,000 deaths.
20,000?
So orders of magnitude. Yes, 20,000. He said, and it may not even reach that.
Talking worldwide or just talking like in the country?
I think that might have, I'm not sure. I can't recall whether that was in the United States or whether that was, hold on one second. Let me see if I can find it. Whatever it was applying to, his original projection for wherever it was 1 to 2 million. And his new projection is now up to, like, the highest would be 20,000.
So what do you think that means?
You can look at.
Do you think that means there's a conspiracy going on, or do you think that's just a revision of projections after new data's come out?
Well, listen, man. People aren't working. Nobody's working. Huck, somebody in your comments just said he just looked it up. He did not retract his projection down. I didn't say he retracted his original projection, by the way. I said he revised it. So, people are putting words into my mouth.
Okay, well, David,
with that said, though...
Go ahead.
Okay. Yeah, with that said, I called a number of police stations in New Jersey today, and I did a live stream on my channel, and I asked the police. I said, according to the First Amendment in the United States, we have freedom of assembly, right? And yet they're saying that they are busting people who are having parties for up 50 people or 10 people, right? As not not allowing to have people have these people assemble.
Sure.
So I asked the police that, and they said they were following the orders, and I said, does this violate the Constitution, the First Amendment? And it was interesting, the responses I got. They kind of got into like a groan, because they're caught. The First Amendment is very clear. We have freedom of right of assembly, and unless they have suspended the Constitution, then that First Amendment does not cease to exist.
Well, so it's not federal agents that are really stopping us from going out and hanging out in parties. A lot of this is happening on the state and local level. There's no federal decree out there.
State and local government cannot trump federal. State and local government cannot trump the federal Constitution.
Actually, there are state laws that do, like, I mean, it's the separation of federal and state powers. I mean, if you're like marijuana, for example, is illegal federally. However, you can go to Colorado and go into a shop and just buy it. Like, there are these separations that do and can happen.
Well, I don't know. I think it's been argued in courts that the Constitution, the United States Constitution, trumps state laws. Like, you cannot make a state law that this is from what I read. Maybe I misread it. I'm fine. I've been wrong plenty of times before. I find it peculiar that they are, for something that now has been revised to down to 20,000 deaths from this Neil Ferguson character. I don't know anybody who is sick or died from this. I know a lot of people, and none of those people know anybody who has died from this, and yet people are being bankrupted. The middle class is being carved out for something that there's no evidence that anything's taking place here.
Whoa, wait, you're saying there's no evidence that people are infected with the virus?
I'm saying there's no evidence that the consequences of what they are saying, the consequences that they're implying that are taking place, meaning thousands or really hundreds of thousands of people could potentially die from that. I don't believe there is any evidence. What makes you believe that there is evidence?
Well, hold on, wait. But that didn't quite answer my question. I'm wondering, do you believe there is a disease like infecting people?
There may or may not be. I do not know.
Okay, so what? So
do you? Do you
yeah,
know?
Absolutely.
Do you know?
Yeah, absolutely.
You know? Okay,
yeah.
What is your evidence? What is your evidence?
There are people that I know who have told me that they have families and loved ones who have COVID. And I don't know why my friends and family would tell me that people have COVID if they're lying to me.
You didn't hear that they say that there's an 80% false positive response rate on the tests, supposedly?
Well, how can there be a false positive for a virus that doesn't exist?
Well, I said it may or may not exist. Didn't I say that? Or are you going to put those words
right,
into my mouth?
But you asked me if I believe...
I want you to answer that.
David,
did I say that it didn't exist?
David, don't make me mute you, dude. You asked me if I believe that the virus is a thing, and I answered your question, yes. The virus is a thing. I totally believe it. So that was in response to your question. Okay. So and you made the counterpoint of, well, don't you know that there's an 80% false positive? It's like, well, that doesn't make sense. There can't be a false positive if there's no positive. Like, the virus has to exist. So that doesn't really, challenge.
Yeah, I mean, honestly, I don't trust the news. I agree with that. But anyhow, you stating that it exists because you know people who have been sickened by it / I don't know, maybe even people who have died from it. If that is proof to you, that's kind of weak proof, because how do you know that the person just didn't die from an underlying disease that they previously had?
Because they have tests for it. That's why they do the blood work. We can test whether somebody has pneumonia.
Have you verified the test? Have you verified it yourself?
Why do I have to verify the tests to know that the tests are
because
true?
the reason why is let's loop back to let's loop back to the UK government reclassifying
why the living hell does my opinion on the tests matter? I have no expertise in the subject. How could I possibly verify?
Does the UK government's reclassification as no longer considering COVID-19 to be a high consequence infection? Why are you talking over me when I speak?
David, I'm talking over you because this is my show. So you can stop talking over me maybe and we can have a conversation, but I can just drop you at any time. This is all up to you and how you behave. So
I just thought it wasn't very polite, that's all.
Okay. Well, I feel like it's not polite when I'm giving you an answer and you're instead asking me other questions. You know, I'd like to pursue just one line of thought at a time so that we can kind of get somewhere. Like I'm more interested in you're skeptical of the virus's existence. And I think that's really, really interesting because like, yeah, how can we know for sure that this virus is a real thing? I want to kind of break that down and see what we can do with that. So like you're skeptical of it. What, like if you could give in summation just 1 point, because I know you have several points, but like what do you think is your biggest reason why you think that the virus may not be a thing?
Well, I think that to start with, I think you hold a lot of weight to government more than I do, but a UK government report that comes out that has reclassified this COVID-19 as a non-HCID, I would think that would kind of interest you and maybe make you question what is truly going on here. Check it out. It's right on UK.gov.
But how does that demonstrate that the virus isn't real? Is that enough to demonstrate that the virus isn't real?
I honestly, I don't know whether it's real or not.
Okay.
I am more
What would
concerned.
What would convince you that the virus is real? What would you need?
I honestly, I don't know if it matters at this point.
It definitely matters if you don't think the virus is real, because if you're going out in public and you might have it and you don't know it and you don't think it's real, your beliefs are going to inform your actions. So I definitely think the question is relevant. I'm just curious as to what line of evidence would convince you that the virus is real. What would it take?
Okay. I would say that if it truly is a highly consequential infectious disease, and there's 1 million to 2 million people dying, and I am starting to see people drop dead all around, I would start to become concerned. But with that said, with a reclassification where they are now saying that under 20,000 people can be expected to die from this, which is less, now it's being considered as weak as a flu by the UK government, I would say, I would ask then, why would the government be interested in closing down the economies for something that's as weak as a typical flu that we experience every year and we've never shut down the government? That doesn't interest you, huh?
Well, it does interest me, but I think that there are other reasons that we could consider. For example, classifications of diseases affect how we might research something. Okay, if a disease is deadly enough, then the tier of how researchers are researching it becomes much more. There's higher barriers of entry. You can't just go into a lab and look at this thing. You got to sign paperwork. You have to have the right equipment. You have to have the right sign-offs. If you're changing the classification,
the UK government has that?
They might have to change their definitions of the disease in order to accrue the right resources to look at this thing. Again, this is pure speculation on my part. I have no idea whether that's true, but I do think it's plausible. Now, I'm just giving you an example of another conclusion we might
Google it.
My first conclusion isn't, well, the UK government changed their definition of this, therefore the virus might not be real. I don't see how that line of logic follows.
I am not saying that it isn't real. Let's assume, since you keep saying that, let's assume that the virus is real to make it real easy. Okay? I'm fine with that. It's real. Okay?
Okay.
Okay, so now it is a real virus that is now as dangerous as the common flu. And that is according to the UK government. Now, are you going to disagree with the scientists who created that report? And I'd like to know why you disagree with them if you do.
I haven't looked at any reports from the UK government, so it's really hard for me to give an exact.
It'll take you 2 seconds. Google it. I looked it up 1 second before I got on with you.
I typically don't like live Google stuff on my show because I have to have it. If I'm going to give my opinion on something, I want it to be informed. A 5-minute Google search is not a big enough time of research, in my opinion, for me to have an informed opinion on this. And if you're just Googling stuff to figure everything out, there might be a problem in your methodology of how you're figuring out whether things are true or not.
I guess you would then say that the UK government is obviously wrong, is what you're saying in their assessment.
No, I don't think I said that at all. I think I said I would have to look more into it. I would have to evaluate the claims, see why these.
So let me ask you this then. So what you're telling me is that literally on the UK government website, it states that it is no longer classified. I read it to you, right? What about that is causing you such a high level of skepticism to not believe that that is true? I don't understand that.
One, I'm not looking at the website. I'm hearing you tell me this. I'm getting this from a secondhand source.
Well, assume that it's true, what I'm telling you.
Well,
assume what I'm telling you is true.
I'm going to assume what you're saying is true, then yeah, there's going to be some conclusions there. But I don't know if what you're saying is true. That's the whole point, right? I got to figure out if that first thing is true before I can make any other conclusions to see if that's true. You see what I'm saying? Like, I can't just.
So nobody in your team can say, "Hey, I Googled it. I looked at it." Literally would take 12 seconds to see that the UK government has reclassified this as a HCID. I mean, that's how long it took me. I got while I was waiting while you guys were speaking on the intro, I had to look this up because I don't know this stuff. You know what I mean? I looked it up. It took me 3 seconds.
Okay. Yeah. No, I'm not saying I don't have the power to look that up and see that it says that. The problem is I don't know what that means. Okay, they changed the definition. What does that mean? Why did they change it? What specific reasons did they give? Are these reasons legitimate? These are all questions that I don't know the answer to, and that's what's more important, in my opinion. If I'm going to make conclusions about skepticism of this virus, unless I can tell you.
I can tell you, I'm on the page. It lists. All right, this is a list of high-consequence infectious diseases that it lists just for your information. It says Argentine hemorrhagic fever, Bolivian fever, Crimean Congo fever, Ebola, Marburg, severe with whatever something, Andes virus infection, avian influenza, H5N1, avian influenza, monkeypox, and maybe 2 or 3 others, okay? Those are all considered these HCIDs, just to give you an idea.
Okay.
Now, it goes on to say that HCIDs, including viral hemorrhagic fevers, are rare in the UK. Oh, so this is for the UK, by the way. Yeah, and I said that already.
You did.
When cases do occur, they tend to be sporadic.
By the way, I'll go ahead and pull it up. We'll talk about it.
Cool. I'm on gov.uk, and I found it. If you Google HCID and just Henry, Charlie, Ida, David, and then you put in COVID-19 and then space UK Gov. UK Gov. Right?
COVID-19. I'm looking
at
that
in. Yep. And information on COVID, including guidance. I think it might be the very first one.
The one that says
it is. It's the very first one on Google. And it says information on COVID-19, and it's from .gov UK, right?
All right. I can't believe I'm doing this, but yeah, I'll look at this with you here. I'm trying to figure out if you have a direct link to it. If you have the chat, maybe we can all look at this together and see what.
Okay.
But here's the thing, right? Like, and I don't want to get too off on a tangent here, but I don't see how Again, the definitions changing on the UK government's website on the coronavirus is evidence that the coronavirus may not be a thing. I'm not sure.
Well, I don't think it really is. I don't think it is. I agree with you. It's not evidence. I agree. It's not. What I'm saying, I'm putting the link in. I'm putting it in the chat real quick. I don't know if it'll go in or not, but I just put it in.
Okay.
I'm saying what I'm saying is I'm assuming that let's assume that it's real, right?
All right.
So what the UK government is saying now is that we don't. This is not a dangerous. Literally a non-HCID. They're reclassifying it as something at the level of a normal flu, and then that would then lead me to say, wow, why is this not getting on the news? And so people can all start to, lose a little bit of the fear that has taken over, and understand that, this thing has been overhyped, and that is something that we have to all agree that the mainstream media, are experts at hyping news stories, right?
Mm-hmm. Sure, maybe. Yeah, depends on the story, but yeah.
Were you able to get that? Were you able to get that link that I put in
I'm still trying to find the specific page. I'm on the website, and I don't.
Yeah, no, it didn't come up when I searched it. It didn't come up correctly. That's why I put the link into another link. Hold on, I'll look for the one HCID COVID.
Okay.
So the link I gave you.
Somebody just sent it to me here, so I've got it. I'm going to open that.
Yeah,
and we'll get this together. And by the way, I want to give a quick shout out again to Matt Dillahunty for having a watch party here for Truth Wanted. Thanks all you guys for watching this conversation. Okay, so I have it up here. Now,
do you see now when you open it? Do you see status of COVID-19 now? Easier. It's like it's right there in your face this time.
Okay, so I just got a link saying debunked. The UK no longer considers COVID-19 a high consequence infectious disease, but social media posts about it are misleading. This is from the journal.
Is that the link that I sent you?
No, this is a different.
Is that the link I sent you though?
No, it's not a different link. But here's an explanation.
But I'm asking, did you click on the link I sent you?
I haven't seen the link that you sent me. I don't know where you're sending it to.
I put it in chat, man.
Are you in the YouTube chat or are you in a different chat?
I'm in YouTube chat. It's under Amazing Chocolatiers.
Maybe YouTube is trying to cover you up and doesn't want you to send the link. I'm just kidding.
Here, I'll put it again. Ready?
All right, go for it.
I'm putting it again right now.
Here we go.
Here we go. You ready? Hold on. 3, 2, 1, boom. All right, I just put it in. You see it?
I see. No, I honestly don't see it. Only mods.
People are telling me only mods can put in links.
That's what it says. So anyway, look, I have.
Can you make me a mod for like 1 second, and I'll put the link in, and then you can not mod me.
I have screenshots of the page here because I'm looking at this other page. It says, as of 19th of March 2020, COVID-19 is no longer considered to be a high consequence infectious disease.
Is that from the Gov? Is that from UK.gov?
This is the screenshot from the website. Yeah.
Okay. Good. Okay.
Yeah. So yeah, it says that they've changed this clarification recently due to more information about mortality rates, greater clinical awareness, and a laboratory test for the disease. And the mortality rate is small enough, so it's only between 3% and 4%, which means that this change of classification, that's why they changed the classification. It also says that the laboratory test to identify COVID-19 was discovered relatively quickly after the disease, so they could test it rapidly. So the explanation it's giving here said that basically because the mortality rate is significantly lower.
Whose explanation is that?
This is, again, I'm looking at
that the government. I don't see that on my page.
Right, because you're looking at the actual government page. This is another page responding to that.
Like who is that though? Who is that you're reading?
Hey,
that's somebody's opinion?
A website called thejournal.ie, which is a website that looks at different news sources and stuff, and gives explanations and commentary on different news stories. So this is a story that's kind of deflating this claim a little bit. But you see, like, this is also a result of Googling things, like if I hadn't seen this page and I just saw the UK thing, yeah, I might be confused, but putting a little more research and context to it, even though, yeah, that took us a little bit of time, but already at least there's an explanation, right? Now we can talk about the legitimacy of that explanation for sure, but here's something. So it's not a complete unknown why they did this. There's at least some reasoning behind it.
And what is the reasoning?
The reasoning, again, according to
according to who? According to who?
I will tell you. You don't have to ask several times. I can get you the first time. I'm looking at statements from where does it say? That's not the right one. So this is from the author is called Orla Dwyer. She has her contact information here. I don't know what her credentials are, but she did take some statements from the European Center for Disease Prevention and Control, and she's also taken some statements from Boris Johnson. I mean, Boris Johnson is just going to say,
right. So she's going to, her explanation of what the UK Gov site, you're just going to go with what some random person interprets? Is that what you're telling me?
I'm not sure if you're listening.
My YouTube channel, everybody, is Zoom Truth. If you want to get real truth, go to Zoom Truth. What?
Hey, David, plug your stuff on here, and I got to drop you because I don't want this to be, just a plug for you.
Oh, you don't want people to know who I am? You want to hide me?
David, you're making a lot of assumptions about me and my explanations for things. And I think the problem might be that you're jumping to conclusions too quickly for us to really evaluate things. I'm starting to see a trend here. Okay. Earlier, I said, look, this may not be the best explanation, but at least this is something we can work with, right? This is something we could talk about. The idea that the UK government put this thing out and nobody's talking about it. Well, I just showed you a source of somebody talking about it. So, we can't go with that narrative anymore. We can't talk about this idea that nobody's talking about it because now we have somebody talking about it. Okay. So now we have an explanation so we can evaluate, okay, what's the validity of this?
Do you think that was, I didn't see that on the NBC, CNBC. I didn't see that on mainstream media news. Did you see that on the news, them talking about that? I don't.
Yeah, I didn't see anything because it looks like there might not be any consequences to this news. Like what are we supposed to gain from this? What am I going to gain from learning about the UK government's change of classification of the COVID-19 disease? How is that,
Well, that's up to you. That would be up to you to decide. I don't want to think for anybody. I was just calling because I thought you might be interested, that's all. It doesn't sound like you are.
Interesting. I know it is interesting. I can't follow the same leaps of logic. I can't go from, whoa, this is crazy, there has to be something nefarious behind this, because I don't have enough evidence for that yet. If more evidence is presented to me, maybe if there's a sequences of changes in definitions from multiple independent parties, or at least ostensibly independent parties, that might be something to go on. Or maybe
I would say, okay, that's fine. I'm interested in your opinion on this.
Okay, go ahead, David, and then I want to get to callers.
Yeah, no problem. I'll be real quick. I went out to Princeton, right? And I asked people in line while I was waiting. There's a famous place called Hoagie Haven where they make sandwiches, right? Well, the store is closed. You have to order through a window, right? Because they don't want to, I guess, have people near each other. So anyway, there was a group of 7 or 8 people standing outside the window waiting to have their sandwiches made. While they were waiting, I asked everybody, I said, hey, does everybody here believe the coronavirus is real? And everybody looked at me like I had 2 heads, right? Of course. So with that, I find it interesting because everybody, right, is concerned about, the danger of this virus, which I understand. The news media has made it very scary. Yet they're not concerned enough so that to not order a sandwich from some guy who's making a sandwich in a back room that who knows whether the guy sneezed, talking over the food, getting germs all over their sandwiches, and they're ordering it like it's nothing. Is that, do you think that's a lack of common sense, or is that denial, or is that just stupidity?
That's an interesting question. How can we evaluate whether other people are following the best safety protocols and stuff, right? So I was talking about my job earlier. I go around to grocery stores and stuff every single day. And I see most people now that I talk to are wearing gloves, and some of them are wearing masks. And I wear gloves and a mask almost every day. I don't always wear the mask because our company doesn't always have enough for people. But I wonder too, when I'm looking at people, I'm like, hey, some of these people aren't wearing gloves. What are they doing? How are they following stuff? And yeah, there is risk involved. Now, specifically where I live in Austin. Okay. So the last count I saw, I think we're around 300 cases. We also have to evaluate, okay, Austin has a population of, around 1 million people, especially if you're including like around the areas and stuff. If you take a percentage of 200 or so people and knowing that those people are tested and positive, so they're probably put away somewhere, what are the chances right now of me in particular contracting it in Austin? Well, I'd say still relatively low. Now, that's not to say that there is no risk, because there is a risk. And every time I go out that door, there's a risk for me. But I can also make the evaluation and say, well, if there's the likelihood is still statistically small, and there's enough of a demand right now for my job, for what I do, that I feel it's important for me to go out and do things. So whether or not you feel there's the same importance to order a sandwich from a sandwich shop, yeah, I don't know. And I wonder about that too. When I order my food, are they doing things? But I'm still doing it, at least for right now. We'll see in a week or two.
Yeah, but all right, so that's interesting, because that's what I mean, though, because I find it interesting that there are thousands of restaurants and thousands of people who are ordering from these restaurants, and yet they have closed down the rest of the economy. It kind of does not make sense.
Well, most people aren't rational. Yeah, go ahead, Sarah.
I was going to say there's also thousands of people who don't think they should have all those restaurants open.
Yeah, it's true.
All right, so then if the restaurant shouldn't be open, really shouldn't the grocery stores then not be open too? It's just as likely you'll catch it, the virus there, right?
Yeah, it's probably more likely you'll get it from a grocery store, but at the same time.
Yeah, so I mean, really, we should be clamoring for them to close everything down and have us locked in our homes, right?
No, I don't think so at all.
For our own safety, though. For our own safety, I'm saying.
Well, we are taking minimizations to make preventions of the spread of disease happen. We aren't completely shutting down, because at least most government entities feel like, yeah, we can still at least have these essential businesses running and still be relatively safe. The goal isn't, all right, make sure nobody gets the virus ever again. The goal is to flatten the curve, right? We're minimizing our contact with each other. Because we're going
to restaurants and we're going to grocery stores.
Right.
But every people are doing that. Like, it's normal. Like, I see people going to them and they're like normal. They're standing in line at my local grocery store. Like, it's like a normal day there for most people.
I think, and some people may not realize the full impact, but I'm not other people, so I don't know why you're asking me. I mean, I'm trying to take
are you trying to insinuate that some percentage of the population is holed up and is not going out to either restaurants or grocery stores? Like, they are completely have isolated themselves 100%?
There's definitely people out there doing that, yeah.
A large percentage of people, would you say? 50% or greater?
I have no idea. Definitely not 50%.
I'm just wondering what your opinion would be.
Definitely not 50% or greater. Yeah, I would say probably. I don't know. I have no data to figure that out. I have no way to make an opinion on that. Okay.
All right, man. Hey, listen. I appreciate you entertaining my thoughts. I know you probably don't think very highly of them. Hey, listen. Also, if you can unban me, man. I will listen every once in a while. I've been banned for a while now. So,
I don't know. I don't make the decisions on the chat personally. I'm not banning. I don't have time. I'm talking to callers and stuff. So that's up to you and what the mods think. And maybe you could, message some of those and figure that out. But David, I want to say thanks for calling. Thanks for talking to me about your belief and why you believe it. At least we kind of got some of that in there. I'm going to go ahead and let you go so we can talk to the next caller here. And I think you're already here. Are you still there? Nope, don't think so. I think we got that taken care of. So that was an interesting conversation.
That was fun.
Yeah. So, Sarah, what did you think of all that? You were kind of quiet for most of it.
I didn't want to interrupt you, but yeah, I didn't understand why having the classification change had him jump to as many conclusions as he did.
Well, I think to his credit, he probably has other things that he's looking at that is making him skeptical, and that he just didn't either didn't want to present it here or maybe didn't have time. Maybe he talks about it more in his channel. But I agree with you. Just that fact doesn't make me skeptical of the virus not existing. Like, I feel like the virus existing evidence is way up here. And then you have this one change, and, you know, the narrative isn't quite there either. You're saying nobody's talking about it. I just found a source of somebody talking about this. And it's like, yeah, I don't think the government is hiding the virus. I think they're taking precautions. I don't think a rational government would want to cripple its own economy for, like, there's no gain there. Where, like, you know, at least with most conspiracy theories, there's some sort of gain, but there's no gain there at all. Nobody is going to be, unless, you know, somebody would have to present me with something of how people can gain. Maybe it's the sanitization industry, like the, you know, the hand sanitizer industry is gaining from this. I don't know. But yeah, interesting conversation for sure.
I also don't understand how it's relevant whether people are taking it as seriously as they should. Like, when you go out and see people who you know are doing stuff they shouldn't be doing, how that has anything to do with how serious the virus is.
It's like, look, other people, I don't speak for other people. Like, I'm not them. Like, yeah, a lot of people right now are they have their own thoughts and opinions on things. Like, that what they're doing isn't matter. Like, if you ask people, I was trying to think of a thing that a stupid thing most people believe, but if you ask people, like, I don't know, the order of the planets in the solar system, there's probably going to be a large percentage of people that don't get that right. Now, that's not an indication of whether somebody's smart or dumb, but it just means that, yeah, like, they may not have that education to, you know, properly say that thing. And yeah, there's definitely people out there who don't have, you know, the right information on this virus. So I don't know how other people's actions influence my belief like that specifically. But anyway, I want to go ahead and go to our next caller